Okay, welcome everyone to the East Lothian IJB meeting that's being held today, the 22nd of May. The meeting is being recorded and will be made available on a webcast in order to allow the public access to the democratic processes in East Lothian. East Lothian Council and NHS Lothian are now the data controllers under the Data Protection Act. Data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention. The webcast of this meeting will be publicly available for up to 6 months. So we'll move on now to apologies and a roll call of attendees. Fiona, over to you.
Thanks, Chair. We have apologies today from Patricia Cantley, and we have a substitute for Patricia in Professor Amjad Khan. We also have apologies from David Binney, from Marilyn McNeil, and from Fiona Wilson. So I'll now take the roll call of attendees. Shameen Akhtar.
Present.
Jeremy Finlay.
Present.
Lynn Jardine.
Present.
Carol McFarlane.
Present.
Jonathan Blaisby.
Present.
Amjad Khan.
Present.
Thank you. Andrew Cogan.
Present.
Is Elizabeth Gordon here? I think she was going to be a little bit late, so she'll probably join shortly. Maureen Allen. Darren Bradley.
Present.
Lindsay Byrne.
Present.
Sarah Gosner.
Present.
John Hardman. David Hood.
Present.
Hilondi Kathangeli.
Present.
Claire MacDonald. Claire McIntosh.
Present.
Liam Kerr.
Present.
Mike Borchas.
Present.
Thank you. That's the roll call done. Can I ask if any members have any declarations of interest? No? Okay, thank you. And there's a couple of brief announcements before we begin. Item 4, there is an error in the report. Paragraph 3.1, the second line, it should say that Elizabeth Gordon was originally appointed with effect from the 27th of June 2022, not the 1st of August. And can I ask if members agree to hear item 11 in private?
Yeah.
Notes. That's
Yeah.
great. Thank you. That's us ready to move on to the business, Chair.
Okay, thanks. Just a brief note about the agenda. We've got the welcome edition of the action log, so and we'll go through that in a moment. And we're also taking minutes of subcommittees and things. These are largely for information, but I think it's important as part of transparency that people are aware of those. I think there are some confidential issues in the clinical governance, but Sarah's going to give us an overview of any key issues from that. But I welcome these minutes being available, and we'll have a very brief discussion at the end if there's any issues that they raise. So again, some slight tweaks to the agenda. So the first agenda item is the minutes of the meeting held on the 20th of March for approval. Firstly, can we take it that if there's any typos and things, people will flop raise them with Fiona. If not, are there any significant matters arising that people wish to raise? Shameen?
Yeah, thank you, Andrew. Just on page 3, section 4, in paragraph 5, I thought that this would be something for the strategic planning group to take forward. It was around the issue of improving engagement levels, so that might be an action point for that group to take forward as we're developing papers and ensuring that there's an appropriate strategy for that level of engagement. And it was an issue that was raised by Maureen Allen, and I just thought that might be the best way to pick that up.
Welcome that, Shameen. I'm sure we'll pick that up as a matter arising in a future action. So,
Can I just clarify, Chair? Is that for the action log?
Yeah, if we just, my way would be to do that as that we flag that as an action, and it goes into the SPG to consider that.
Right. Okay.
Is that okay?
Thank you.
We'll get through how these things work their way through with the action log, and we'll learn as we do that. Laura.
Sorry, and I don't know if this is confusing matters. So we've got the SPG development session summary coming to the SPG, I'm going to say the 5th of June, which picks up the engagement and the requirement for us to have within the SPG template an engagement section, and how we are going to ensure that we can evidence the engagement through our engagement plan that will come to the IJB later in this year, etc. So I'm just wondering if that action has been picked up within the SPG development session. It will come on the 5th of June, I think is the next SPG, Neil, is that right? Yep, 5th of June. So I'm not sure if we need it as an action for the IJB. I think it was an action for the SPG, which has been picked up. If that's helpful.
It's wonderful when an action's already completed before it's asked for. That's Shameen, are you happy with that? Let's not create too much bureaucracy.
Yeah, that's going to happen, and then I'll be content with that. And if we could pick that up with Maureen Allen, because I think she's raised that quite a few times, that'd be helpful.
Brilliant, thanks, and thanks for flagging that, Laura, as well. So, any more items from the minutes of the last meeting? I'm not seeing any hands. In that case, we'll take it as a correct record. I'm assuming at some point, do I sign anything, Fiona? I'm learning this, or is the or is the approval here sufficient?
Once the minutes are finalised, I'll arrange for you to add your signature. Yeah.
Thank you very much. Okay, we're now on to the action log, and as I said at the introduction, I think this is a welcome addition. We'll work our way through this. I know Fiona's done some work in liaising with colleagues in NHS Lothian and the other IJBs on how they do that. Jonathan, you were an advocate of this. Is this okay in terms of format and layout for you?
It's fine, yes.
Excellent, thank you. So we'll quickly go through from the action log. The first one there is to provide an update on the proposals for Musselburgh. It's on the agenda for today. The action of preparing an action log. We have one here. It's recorded. To consider arranging a development session on the work of VCEL and Enjoy Leisure. There's no action. There's no owner for that. Is that going to get picked up as part of the development session planning? Looking at Laura or colleagues.
Hoping other colleagues would have chimed in. I think Neil's going to say that we were potentially going to look at it. Neil?
Yeah, so it is on the list of tentative items for next year's role after the summer.
So I think we can put then Neil down as the action owner for that. To include in future IJ meetings, agendas, regular update shares of minutes from the various subcommittees. That's action today. Formal budget offer from NHS Lothian is in Mike's paper. And to nomination of Hayley Barnett as the IJB Standards Officer. And I think that is still waiting approval by the Standards Commission. So, Laura?
Yep, so that's all three. So that can just be taken up as an action. So that's completed.
Okay, so in terms of all of these actions, they're all completed. I'm sure we will repopulate at the next meeting with any actions that we agree at this meeting here. Okay. Any other thoughts, comments around the action log? I'm seeing no hands, so in that case, we'll move on to the chair's report. I really only represent the IJB externally on the IJB chair and vice chairs network, and I'll update very briefly on that. And if there's any other meetings that I'm engaged with as chair, I will of course give a verbal update of these meetings. So I just want to give a highlight, and this might be the nature of a future presentation. There's been quite a bit of work ongoing with Scottish Government around the health and social care reforms, and Fiona and I attended a workshop with Scottish Government colleagues and colleagues from a number of IJBs a couple of weeks ago, and there is a programme of work that's ongoing, and that programme of work is producing three outputs. The first one is essentially a health and social care operational recovery plan, and that's now in the public domain. So have people seen that? Have people been looking for that? Not seeing any. So Neil, I think what we'll do is that it's now in the public domain, so I think we can circulate a link to that. There are two further documents that are being prepared by Scottish Government. The first one is a population health framework that's due for publication in the spring, and the second is a health and social care service reform framework that's due for publication in June 25. And there's a little presentation around this. I'm not going to give the presentation, but I think it's okay to be sharing, so I will circulate that via colleagues to members of the IJB. I think what is in there is very welcome. It is a significant emphasis on the importance of health and social care and the change and shift from hospital care to community and home care, and as such that's going to be of significant importance and a real awareness for us as an IJB as we move forward. There has been some level of input from IJB chairs and vice chairs, and people have contributed to that. COSLA, which is that's the local government association, they've been very heavily in the input, and as soon as we get an output from these we'll share. But I think it might be worthy of a brief session either at the next IJB or at a development session to go through these publications and what they have and implications are for us in East Lothian. So I'll just pause there. Shameen, have you seen the documents? I think it's kind of in and out of the vice chair and vice chair's network, but
yeah, I agree. It'd be helpful to circulate that around. And just before we joined, there was a letter sent by the chair and vice chair network, and that might be, Andrew, something worth circulating around to all members as well, to the cabinet secretary, just for information.
I've not. Was that an email earlier today?
Yeah, just today.
Okay. Great. Lynn?
Yeah, thanks for that, Andrew, and I appreciate a brief report from the chair. Similar to my request last year of Shameen, it might be useful if you could consider a written report, so that, and you could have potentially have put links, etc., into that. Sorry, just given the level of documentation we've got around everything else, it might be helpful if you could consider doing that as well. Thanks.
I'll certainly consider timings. I've just come back from a 3-week holiday and the week's full of committees, so you understand how these challenges are. If a written report is required, then I will certainly consider that, Lynn. Thank you. Jonathan?
Yeah, I don't know if we pick it up here or in the workforce strategy document, and I don't even know if this is even relevant to us, but in terms of what the UK government has been, it's obviously well documented in terms of what they're contemplating on work visas for overseas work visas in the social care sector. To what extent could that impact us, or more broadly actually across Scotland, and in the context of this report you're talking about?
I think we have a natural segue into the strategic workforce. So let's hold on to that, Jonathan. It's one of the discussion at the workshop I went to. The announcement had just been made in the UK Parliament, so it was very pertinent, and I think there was lots of work going on within Scottish Government to assess the implications of some of the changes from the UK government on that. But let's discuss that as part of the workforce plan. Okay. There was one other minor thing just to note as well, which is the establishment, we discussed it last time, of the NCS interim board. To the best of my knowledge, no chair has yet been appointed to the National Care Service interim board, and there has been a representation made by the IJB chair, vice chair and chief officers network, and Professor Salman Sengupta from, I think it's Lanarkshire, is the IJB's representative on that interim board. And I've not heard anything else since in terms of the formation of that. But again, Shameen, you might have picked something up whilst I've been away or anything.
No, I haven't anything more than that, Andrew.
Okay, hopefully then in the various documents to come out from Scottish Government, there may be some further reference to National Care Service and potential implications. So we wait with interest on that. Okay, so we move on to our next agenda item, which is number 4, the reappointment of IJB voting member. Paul, are you going to just introduce that, I think, or is it David? I can't remember from the emails.
Yeah, Andrew, it'll be myself. Paul's got another commitment that he can't make it, so okay. I'll briefly talk to the report. So just very briefly, the report is set out in front of members. So this is really just to inform the IJB of the reappointment of a voting member to the IJB representing NHS Lothian. So by way of background, I think we've already noted that Ms Gordon was originally appointed to the IJB at the end of June 2022 and can serve a period initially of 3 years before needing to be reappointed. At the NHS Lothian board in April 2025, there was an agreement that Ms Gordon should be reappointed as voting member for NHS Lothian, and therefore the kind of paper is just coming forward for members to note that Ms Gordon has been appointed for another 3-year term in line with the kind of normal processes. So nothing much more to add than that, but happy to take any questions if there are any.
I think this is just noting and its due process. So I see no hands being raised. So thank you for that, David. And we duly note Elizabeth's reappointment. Okay, move on to the next substantive item, which is item 5, the reporting processes around strategic development framework for NHS Lothian and our own and the development plan, our own strategy. It's got Rebecca Miller here to introduce this, but is someone from the HSCP going to introduce it?
No, I think we're going straight to Rebecca.
In that case, welcome, Rebecca, and over to you.
Thank you very much. So I don't want to read through the whole paper, but essentially this item is about ensuring appropriate oversight and governance of NHS Lothian's plans that apply to the functions that are delegated to the IJB. So specifically, I suppose, our plans around mental health, around primary care services and unscheduled care under the LSDF, and also NHS Lothian's annual delivery plan, or ADP. So for the Lothian Strategic Development Framework, or the LSDF, which I've spoken about here before, we're proposing that the implementation books that apply to those delegated functions are shared with the strategic planning group in line with the Lothian planning cycle, which means the annual report on progress against the LSDF would come around June time each year, and the mid-year review that we usually do around November time in NHS Lothian would come towards the end of the calendar year. So we run in financial years. And the strategic planning group will have the opportunity to identify any items or issues for consideration by the IJB that should be brought here. And for the annual delivery plan, which largely reflects our implementation books under the LSDF, but also responds to any specific asks from Scottish Government, we propose to share our draft annual delivery plan with the strategic planning group for information and for comment ahead of submission, and for the final version of the annual delivery plan again to come here to the IJB for approval. When we discussed this process at the strategic planning group, we spoke about a couple of things that would be helpful around clarifying the involvement of East Lothian colleagues in each programme of work under the LSDF, and making sure that we maintained that focus on shifting the balance of care, which is really important to the IJB in those reports. So we'll be mindful of that. And we also spoke about the value of public involvement and engagement in the development of plans. So we'll make sure we reflect all of that when we're reporting. So absolutely happy to take any questions, but really, I suppose what I'm looking for ultimately is your approval of this process, and we'll start to implement that.
Thanks, Rebecca. We'll open that if there are any questions or queries to Rebecca. Shameen.
Yeah, thank you, Andrew. And thanks, Rebecca, for presenting it. You'd presented it at the strategic planning group. And I suppose my question is around taking advantage of you being here and just looking at the broader, wider picture, not just the one areas that are delegated to the IJB. It was around children and young people. And I know there's a children's strategic group of opportunities of influencing the other way, where those groups can influence the work that's happening within NHS Lothian, especially around the Haven closing in Haddington, and looking at the CAMS waiting lists of other ways that we could be supporting children and young people in mental health. And I just wondered, are the opportunities for other colleagues, even though children and young people are not delegated to East Lothian IJB, that are working in that field, to be able to influence that or contribute towards that work?
If this is not in your sphere of influence, Rebecca, you can always say you'll get the appropriate person to answer that question. I think the question's legitimate. Whether I'll let you see fit to answer that, Rebecca.
Shameen, you always ask the best questions. So it is a bit complicated because of what's delegated to the IJB and what isn't. But yes, the Children and Young People's Programme does again include representation from across the Lothians. So under the Children and Young People's Programme, we do link with the Children's Partnership Boards, which include the local authority and NHS Lothian staff in each area. So there is that same opportunity to influence, I suppose. The part of the question that is probably more difficult for me to answer, that I'll need to maybe speak to Colin Briggs about, is the bit about the role of the IJB in that.
Yeah, it was more just taking advantage of you being here covering all of these areas, and we just want to make sure that we're supporting where we can the system and coming up with other opportunities or ideas to support those challenges that we're all facing in supporting children and young people. So yeah, any feedback on that would be really, really helpful.
Thanks, Rebecca. Lynn?
Thank you. Rebecca, I'm going to sound a bit dense possibly, but it's an issue for us across the partnership and making sure that we understand the language that's being used each way. And I suppose I'm looking for a little bit more insight into the term implementation books. And does that to me implies that you're looking for particular outcomes? I'm just curious as to how those outcomes are measured and the progress against them sort of overseen, where that actually sits in terms of what oversight this IJB has on that relationship.
Yeah, again, a really good question, Lynn. So our implementation books is a term we use, and I suppose it's our strategic plan under each of the pillars of the LSDF. So, for example, under the unscheduled care pillar, we have all of our plans related to unscheduled care and the things that we want to do across Lothian. So the things the 5 organisations want to do together, NHS Lothian and the 4 integration joint boards. So in those implementation books, we refresh them every year to look back on the past year and how well we've done. And there are KPIs in there, or key performance indicators, the measures that we're measuring, the things that we want to improve on. And then we look at whether we want to develop or amend our plans for the coming year. So it's basically a refreshing of the plan under each pillar every year. But it does include that, how far have we come, how much progress have we made, where are we going next? And helpful, I think, to have as much scrutiny as possible of those things. So we're doing the things we should do. Okay, that's great. Thank you.
Rebecca, are you confident that the process that you're proposing will pick up some of those issues?
I hope so. I think that it's iterative, isn't it? I'd really like to I'd like to really get a feel for whether everyone thinks that it's helping, and that it's helping us to be more open about what we're doing, and having the opportunity to ask questions.
Thank you, Rebecca. Any more questions, comments, observations for Rebecca? I take it you're doing this times 4, Rebecca, to each of the 4 IJBs within Lothian. So
yes, well, I'm changing roles at the moment, but so we're trying to work out how to do that. But yes, the intention is to do this with each of the IJBs.
Brilliant, thank you. So the recommendation is that we approve the approach that's outlined here. Are we generally in agreement with that? I'm seeing plenty of nods and things. So in that case, Rebecca, we are approving and supportive of the approach that you've outlined, and we look forward to that information coming through to the SPG as required. So thank you very much indeed.
Thank you.
Okay, our next agenda item is around integrated models of day centre and dementia care in Musselburgh, and I think Christine is going to introduce this.
Yes, I am. Thank you. So just to recap, due to the financial recovery programme, IJB agreed to pause and undertake a review of the development of the centre last year, and then that review and the business case was reported to SPG in January and May this year, and recommended exploring an integrated model of a new day centre with the existing Dementia Meeting Centre. So in terms of background on the review, there was a number of key findings. Firstly, that the existing 9 day centres are working at capacity, they're meeting complex needs, and they provide a high quality, low cost model of intermediate care. The main financial benefits from the day centre approach arise from opportunity cost savings, so reducing the hours of care at home, reducing the number of care home placements and replacement care, all of which are higher costs. And the other significant finding which led to the integration consideration was the fact that the day centre wasn't developed, and therefore left the meeting centre with people whose needs were far too complex for them to meet. So that was the reason that we started looking at the integrated model. So in terms of the integrated model, we've taken a co-production approach. It's been taken with full engagement and transparency with communities, carers, existing centres and providers. So we still see there's a high level of unmet needs in Musselburgh for older people with complex needs. And the SBAR paper sets out a number of key benefits from integrating the approach. So looking at a clearer service pathway, better partnership working, better services for carers, community buy-in, as well as the financial efficiencies of moving to one provider through a reduction in management and other costs. And it also avoids competing for resources and supports the sustainability. The main barrier to implementation of the model at the moment is the lack of designated premises. However, we've got a number of positive conversations underway with partners, and these are still ongoing. So we're really looking at taking an approach which is for this financial year to continue the existing meeting centre model and transition to the new model. From April next year, look to commence a new day service outreach and meeting centre in a shared community space, and in the following year the plan would be to launch an integrated service from a specialised space. So we've done an integrated impact assessment that highlighted the lack of available mitigations if the development of the day centre ceased. So moving on to the financials, clearly the Health and Social Care Partnership, we're operating in a challenging financial environment, and this development must deliver a financially sustainable service that ensures no additional pressures across the system. The original funding for the centre was previously approved with funding secured from redesigning an internal transport service. And so although the development was paused in the financial recovery programme, the costs associated with the service remain in budget for this financial year at 149k. And the paper sets out that by integrating the model and using some unallocated voluntary funds, we can deliver the centre for 92 instead of 149k. So just to conclude, of course, these are challenging times to invest in a new service. However, this proposal will create a sustainable model of service delivery at relatively low cost, developed with community partners, and it will support the strategic objectives of early intervention and prevention and developing intermediate care. So I'll hand back to the Chair for any questions before we look at the recommendations.
I put my microphone on mute, didn't I? So let's open it up to questions, comments, observations. Thank you for the presentation and at the succinct way you did that. That's really helpful. Shameen.
Yeah, thank you. Thank you, Christine. I know you've been working really hard in progressing this, and I think the integrated impact assessment was a really powerful one, just to articulate really clearly what a difference that would make to the whole system, and the importance of having it and the level of need in Musselburgh, and the 84% of the people would meet the criteria to access it. You've talked about the timescales. I just wondered if I know you said there's difficulty in providing space. And there was space at Rosehill. Rosehill was built in a partnership approach to have a space there at the Rosehill High School. The Acorn Suite was a day centre there, and I know that's not possible to progress with that anymore. So I think that's disappointing we're not able to do that, but that's just the case that it is. If you're able to identify space earlier, will you then progress earlier? So I know you've put time scales there, but just looking at the level of need that's required, if you're able to progress faster, is that something that you will do if you find alternative accommodation that's more suitable and
Absolutely.
bring the timescales forward?
Yeah, we can certainly bring the timescales forward. Obviously, it's a bit chicken and egg because we had to have the funding secured and approval before we can sort of, you know, create sort of formal agreements with different providers and accommodation spaces, but we'll certainly do that. One of the things that will affect the timing is the need for the Care Inspectorate to approve the premises and the service design model. So it's not something that can be done overnight, but we will certainly make sure we can do it as quickly as possible and get all the approvals in place.
And I wonder if you could comment on the work that's been done with the Musselburgh Dementia Meeting Centre. I think it's really good that you're working in collaboration with them. Could you maybe just say some of the feedback that they're passing on to you by taking this forward in an integrated way, and what difference that's going to make to?
Yes, absolutely. So they've been a key partner in delivering the partnership's dementia strategy, and the work that they do has been really well regarded and is actually one of the good exemplars across Scotland to have. So we're really proud of having that meeting centre in Musselburgh. But as I said, what was happened is we created this kind of cliff edge whereby the people that go to the meeting centre as their dementia progresses, the centre is not regulated to provide that kind of care, but they're really keen and really excited about the prospect of having an integrated model which would allow people who go to the meeting centre with mild to moderate dementia to get to know people who are delivering the day centre and create a really natural pathway as their disease progresses. And it will also really provide continuity for carers, which is key, and provide really high quality support for them. So they're key partners and they're absolutely engaged and signed up to this process.
Yeah, thank you.
Mike, could I just confirm, let me ask my question first, Lynn, and then I'll bring you in. I should have put my hand up to myself. Mike, just to confirm that there is budget for this in 25-26, and it was a pause. So therefore there is funding, and that funding is the proposal is to be at a lesser level. So in the isolation of the individual budget line, there is budget for this. In the totality of the financial pressures that we face going forward, all of this needs to be considered in the whole. But in terms of the specifics of this one,
yes.
Thank you. Lynn.
Yeah, thanks. It was really just a comment more than anything. I think you know, if I had a question, I would have picked up the same as Shameen. I think it's really important to see the layout of the appendices here in terms of the way it's been thought through, and I really welcome the fact that the design thinking diamond format has been part of that understanding. I think I'm mindful as well about just some of the longer term sustainability of this in terms of, you know, we've done the financial kind of consideration over the next couple of years. What do we think needs to be in place for the longer term?
So the funding model is benchmarked on the existing day centres, which is, as you know, have been operating for quite a number of years, and they're currently contracted for around 6 years. And one of the successes of that model is the fact that they're run by small local charitable organisations, and that the management, in terms of the management committee, is run by volunteers, which does reduce the costs. So not only does it reduce the costs, but it also means that these services are embedded very well locally in their communities, and they have the support of the communities going forward. So we would be looking to benchmark this centre alongside the planning that we have over the next 5 years for the other centres as well.
Okay, thank you.
Okay. I'm not seeing any other hands. So do you want to take us through the recommendations?
Yeah, I can do that. So the first one, recommendation 2.1, is to note the findings in the S-bar, which was considered at strategic planning group. 2.2 is to agree the implementation of an integrated model of dementia meeting centre and day centre. and 2.3 to acknowledge the challenging financial environment facing the IJB and the need to ensure all developments deliver financially sustainable services.
Okay, I am very much supportive of this. I'm looking around at colleagues and I'm seeing quite a few nods that people are in agreement for this. So, and even a thumbs up, even better. So I think we then acknowledge the consensus and unanimity on this. I think in terms of some of the operational issues that Shameen flagged up, I think we leave to the appropriate operational colleagues to do their best in terms of its implementation. And our role as the strategic planning body is we've approved it now, and then we wish the best to operational colleagues to get this as up and running as quickly and as smoothly as possible. Shameen?
Yeah, I think it might be useful to the integrated impact assessment that Christine and our colleagues carried out. It's a really clear rationale of the financial sustainability of taking this forward, and that might be useful to share in the minutes, that these are the kind of things that are early intervention and prevention, and we can see the difference already from the statistics and the figures that were included in the integrated impact assessment, that it would in the longer term would be better outcomes, but also save the system money.
Duly noted, Shameen. Thank you. Okay, Jonathan.
Yeah, just only comment I have is just as we often say at these meetings, and when we talk to officers, is if it's possible to do this in a quicker time frame, then let's try to do that. I think looking at the papers, we're looking about a year away before this gets done. I appreciate, as ever, there'll be reasons for that. But if we believe as an IJB that this is the right approach, then I think we should be trying to prioritise and get these in place quicker for our communities. I don't think that necessarily we should be waiting quite so long for these to be put in place.
Thanks for that, Jonathan.
It's easy for me to say, of course.
It is. Yes, but I'm sure we have confidence in our colleagues from the HSCP that they will do everything within their power to implement the decisions of the IJB as quickly as possible. So, and we look forward to that. So, and I think the quality of the paper and the way it was set out, I think it helped us all in coming to a conclusion around this. So, thanks to Christine and teams for the quality of the paper on this. Let's, as we come to an ever more challenging environment, this type of analysis in the individual and also in the totality will significantly help us in our decision making as we face some fairly challenging times in the future. And I think there's a bit of a benchmark set here. So thank you for colleagues from the HSCP for the work that's gone into this. Okay, so we move on now to item 7, which is Mike, your finance report.
Thank you, Chair, and good afternoon, everyone. Hopefully you've had a chance to have a look at the finance report. I just want to spend the next few minutes sort of highlighting some of the key messages that hopefully have come out of that. The purpose of the paper is twofold. Firstly, to update the IJB on the 2024-25 year-end position, and secondly, to present the final funding offer from NHS Lothian for 25-26, and to seek the IJB's approval to accept that offer. In terms of the 24-25 year-end financial position, members will remember that throughout last financial year, the finance reports were forecasting a significant overspend for the year end. Both partner organisations have now closed their books, and the table on the second page, I think it is, of the report summarises the financial position for both delegated functions. It should be noted at this point in time that all these figures are draft in terms of they haven't been through local governance, and they still have to go through external audit as well. What the table is summarising, or what the table is telling us, is that the health delegated functions reported an overspend of 794,000 at the end of the last financial year, and the council delegated functions reported an overspend of 2.8 million, giving us a total overspend of 3.597 million, which is exactly in line with the most recent forecast in the February finance report. It's also important to note that these figures reflect the the outcome of all the efficiency delivery and also the inclusion of any general and earmarked reserves that have been released during the year. So whilst there were some over and underspends in specific services within all of it, across the Health and Social Care Partnership, on the whole, the outcome was exactly in line with the forecast, as I said. In keeping with the scheme of integration, when an IJB report or when East Lothian IJB reports an overspend at the end of the financial year, and following the implementation of any recovery actions and the release of any general reserves, then we are able to seek additional allocations from our partner bodies to the tune of the overspend against their delegated services. So in this instance, NHS Lothian have provided an additional 794,000, and East Lothian Council have confirmed that they will fund the 2.8 million overspend against the council delegated services. So we now are able to report a break-even position at the end of 24-25 for the IJB. In terms of efficiencies and the delivery of efficiencies, Table 2 summarises all the efficiencies against their planned levels in 24-25. We're always looking for efficiencies to deliver on a recurring basis, and the health efficiencies delivered 93% of their schemes on a recurring basis, and council schemes were delivered up to the tune of 45% on a recurring basis. The schemes that didn't deliver, and I think I've said this in previous papers, we will review all these schemes that didn't deliver to see if they're still viable, and if they are, then we'll look to implement them over a suitable timescale. The last part of the 24-25 picture or jigsaw is the reserves, and the third table in the paper summarises the movement in reserves throughout the last financial year. As you can see, the remaining general reserve was released during the year, and we now no longer have a general reserve. The earmarked reserves that could only be utilised for specific purposes have been actioned in the relevant way and released where appropriate. You'll see that there's an additional couple of lines in the reserves there for the unscheduled care allocations that the health sector received towards the end of the last financial year. And those are being used to fund the developments in our hospital to home and discharge to assess services. And these services seem to be starting to deliver against the Scottish Government criteria, which will allow us to get that funding on a recurring basis. So that's good news at this point in time. I think overall that's all I really want to say about the 24-25 position. The last part of my paper refers to the final funding offer that we've received recently from NHS Lothian for 25-26. And that's following the agreement of their financial plan at their April board meeting. But I should point out that the funding letter that we received, which is attached as appendix, does mention the fact that NHS Lothian at this point in time doesn't have a balanced budget, which means it can only give limited assurance that it will break even in this coming financial year. The offer is largely in line with the previous indicative offer that we received towards the end of the last financial year. It is a fair offer and it meets the Scottish Government parameters in terms of passing on all the funding that the IJB should receive, that the Health Board itself has received from the Scottish Government. So on that basis, I would recommend that the IJB approves acceptance of the funding. The last part of my paper just reminds everyone of the challenging financial circumstances that we're going into. We're already seeing emerging pressures in this current financial year, and we're only just 1 month into the financial year, so that's going to require us to generate additional efficiencies in year to deal with them. And we know that we're going to have to start looking again at transformational change opportunities that we can start to plan to deliver in coming financial years to address some of the gaps in the funding that we are seeing in our 5-year financial plan. That's all I wanted to say just now, but if I've got any questions, then more than happy to try and answer them.
Okay, thank you very much, Mike. So let's open it up to any questions, thoughts, observations, comments. Shameen.
Thank you. Thanks, Mike, for the report. There was just two things I wanted to ask. One was around, it's helpful to get the offer letter from NHS Lothian, and I just wondered, in your discussions with them, the Scottish Government had placed a really strong emphasis of more community-based services, and I just wondered, does that reflect in that additional resource reflected in our offer, or is that something that we might find out later on? Because I think when members of the local community see those messages, then what they look for is more community-based services in our area. So if there is any additional resource for East Lothian, that'd be really helpful to know, because we're one of the second fastest growing areas in Scotland. And the second one you've touched upon is the reserves in 3.10, and it was just to go through our proper governance of that decision for 24-25, which was that if NHS Lothian broke even, that reserve would come back to East Lothian IJB. So just for kind of completeness, if you're able to give any feedback on that at all.
Well, I'll, in terms of the first question that you asked there, I mean, it's very early in the financial year, and we haven't had any, what I would term, additional allocations at this point in time. But I think any additional money for community services will come as an additional allocations, and if NHS Lothian receives that, then we would expect to get our share of any additional monies that come in. But I'm not aware of anything at this point in time. The funding offer that they've given us is based on their base budgets, and as you know, they will get significantly more funding during the year in separate allocations as they arise. So it may well be that these allocations will include things around community-based services, and if they do, then we will expect to get our share of that money. In terms of the reserves, NHS Lothian, well, I suppose that the way to answer that question is the East Lothian IJB still reported an overspend against its health delegated functions. So if East Lothian had reported an underspend, then certainly we would probably have had a case for asking for some of that. We would have had a case for trying to get some of that general reserve back. But we still had an overspend, so there was no opportunity for us to get that funding back. If we hadn't had that 3.1 million general reserve, then we would have overspent by an additional 3.1 million. I don't know if that answers your question or not. I mean, the Director of Finance for the Health Board has written to the Chair of the IJB confirming the financial position for NHS Lothian, and made it clear that there was no funding to pass back under the not the rules, but the way in which the funding was allocated out. So as far as I'm aware, there's no opportunity for us to get any funding back.
Okay,
that's duly reported in the paper as well, Mike. That's my take on it.
Yeah.
Okay, I think. Yeah, no, thank you, because that decision was made on the basis that reserve would go back, and I would ask it might be an opportunity to ask them to go back and review that position that they've taken.
But there is no underspend for the reserve to come back. There is no money to pass back, and East Lothian was overspent. If by drawing down that reserve we put ourselves into an underspend position, then yes, but we didn't. We still overspent.
Shameen, or is this something maybe you want to take slightly offline to?
Well, I can
we'll
take
get
that
into
off.
Technical issues around the accounting side of it.
Yeah.
From an audit perspective, I'm assuming this is now going to go forward into the end of year accounts for both IJB, NHS Lothian, East Lothian Council, and the sum total of all of those three will be the delivery of our statutory financial duties, balance, etc. So.
Yeah, I'm happy for it to go through the the audit process, and I can pick it offline, because my understanding was that if NHS Lothian broke even, then that reserve would be passed back, which is my understanding from the minute of the meeting, but I'm happy to take that offline with you.
Yeah, I think that would put NHS Lothian into an overspend position, so it wouldn't have been able to give us the 794,000 that it gave us. So, but anyway, yeah, we can talk about it outside the meeting.
Jonathan.
As well, Mike. I mean, we
overspent. I can't hear you, Jonathan.
Oh.
Try.
Yeah, can you hear me?
That's much better.
Yes.
No, I don't know what happened there. No, I agree, Mike, and that was my understanding as you described. We overspent and they had to pay for it somehow. In the agreement as an IJB, we voted to use those reserves, and so there isn't anything else to come back as far as I'm aware. But anyway, and I guess my question is sort of just to be a bit more precise here, but looking at the paper for 25-26 is just to sort of maybe reconfirm where we are in terms of our budget for NHS Lothian. So the offer of 127 will go up 3% or so that'll give us 131 roughly. We spent 147 last year, so there's a deficit of 15 million and there's a gap there, and the reason for the gap is because of these non-recurring payments we get from the Scottish Government, which I find quite strange and difficult to understand from a budgeting perspective. If we're saying we've got a 15 million gap, but we don't have a 15 million gap, we only have a 3 million gap, which was in the paper we had in the last IJB meeting, which obviously takes into account some of those non-recurring payments, which we're saying are non-recurring and we don't know if we're going to get them. So we sort of go around in this very strange loop in my mind. But can you just confirm, and I don't know if I've described that very well, kind of what the latest position is in terms of our budgeted deficit? Is it still 3.4 million or slightly different to that from the health perspective? And also, what's the latest council position as well? I think last time there was basically a very small, less than 1 million deficit or even a surplus. I can't remember now. So that's not in the paper here, but I just think it'd be useful for the IJB just for you to briefly summarize where we sit exactly in terms of the budget deficits for health and for the social care side. Does that make sense, Mike?
It does. We agreed a balanced budget at the start of the financial year, and that was based on gaps within health and social care delegated functions, with efficiencies identified to cover the majority of those gaps. The balanced budget was agreed on the basis that we would work towards a collaborative working solution to the set aside element of the health delegated functions. So that wasn't fully funded or fully closed in terms of the gap, but we agreed to set a balanced budget on the basis that we would work collaboratively to close that gap. Just going back to, I suppose, where you started with in terms of your confusion, I can totally understand the confusion. When I looked back myself at last year's funding offer, last year's funding offer was 113 million at the start of the financial year from health, and our budget at the end of the year was 158 million. So we get a significant element of additional budget within the year, mostly through allocations from the Scottish Government. And the reason that it's not as big a risk as it might look like on paper is because we are confident that we will get most of these allocations. It's the way that the Scottish Government provide those allocations. They don't put them into our base, which means that they don't have to uplift them. So we are confident that we will get the majority of these allocations. There are also adjustments that will go on in year between different budget heads and so on and so forth, which will have some impact on that. But I'm sure that our budget will be an awful lot more than 127 million at the end of the financial year, on the basis that we will get significantly more allocations through. And we have services in place and we have people employed to deliver some of these services. So the risk is huge if those allocations suddenly stop for no apparent reason with no apparent warning. So the expectation is that we will continue to get those allocations, and the expectation is that in terms of the budget setting process, the gaps, any gaps that remain will be closed with the collaborative working around the set aside functions and the delivery of the schemes that we already have in place to meet the initial financial gap that was highlighted in the budget setting paper. Does that?
Yeah, look, I mean, I understand all of what you said there, and it's just oddity, but we've been asked to accept a funding offer of 127 versus an actual expenditure of last year of 147, so 20 million gap. And what you're saying is finger in the air job. Oh, look, you know, the Scottish government always gives us something during the year, always gives health something during the year. It will come in. You know, we need to don't be too worried about it. And I find that personally a little bit worrying, but also I don't understand how we've set a budget when we must have put a finger in the air to work out what a break-even budget was, because if we didn't, we'd have a 20 million gap. So somebody in the system has said we are getting these allocations, and it is perverse as a budgeting approach. I'm going to say. I don't get it. I know
the board of NHS Lothian has exactly the same issues, does it?
Well, exactly.
Jonathan?
I mean, you know that I talked to Craig about this. I've done it loads of times. I mean, I know this is a health thing, and I keep on talking about it because it does not make sense from a budgeting perspective for an organisation where we're having to basically just take it on faith that we are going to receive at least, I think, 15 million, Mike, from the government to NHS Lothian, who will then pass it through. We know that. I'm just trying to be clear on what we're actually accepting here, because we're not accepting really 127. We are accepting, I guess, 140 something. I guess I'm sorry to be a little bit, awkward. I guess argumentative about it.
No, it's fine. I wouldn't say we're taking it on finger in the air or faith, because the allocations that we're referring to are termed earmarked recurring allocations. So they are recurring allocations. We just don't get them into our base. So we expect them. We are entitled to expect them. There's no reason to doubt that we will get them. I can understand your question around what are we accepting here. We're accepting the final offer that NHS Lothian can give us, because NHS Lothian have only been advised by the Scottish Government at this point in time that they have on their base budget funding, and that's what they can advise us on. So their base budget funding and the uplift that they will get, which is 3%. Other earmarked funding will come in during the year, but NHS Lothian has provided us with an offer based on what they have at this point in time.
Yeah, I think it's non-recurring though, Mike. It's not recurring. I mean, even in the letter from NHS Lothian, they actually say it excludes to non-recurring allocations. So I don't think it's right to say it's recurring, because it does come in every year, but it's not specific. It's, I'm sorry, we're just being. I'm not trying not to be pedantic, but it's not recurring.
I'll let you two argue that as accountants offline. So,
I just want to be. Anyway, sorry, Andrew. I guess sorry, Andrew. Mike, sorry, I'll just. Let's decide how is this done. This just from a overall how an impact perspective. And
I don't know about your voice is disappearing again, John.
Oh, sorry. So just can you hear me?
Just about.
Yeah. Sorry, I don't know how to change that, but just basically to confirm that we are at a break even based on a previous meeting. Then that's we finish it there.
Yeah.
Yes.
And I think David can come in. I was offering, but before that, I think all of this is kind of the distraction away from what we need to be doing, which is that transformational change, those issues that Shamim raised, which is how do we use our financial envelope to shift the where care is provided. We sometimes get lost in the way in which the IJB is funded, both from council and from NHS Lothian, that detracts from the work. And we've got to be really strong as an IJB that we've got to do that work whilst the finances somehow take place over here, and the rest of the year I think is going to be much more focus around how we do the work whilst we work through slowly the vagaries of how Scottish Government fund local councils, fund NHS in a very interesting way. Jonathan, I think it will be fair to say from an accountancy point of view that makes it really difficult to do the real work that we know that we need to do.
Yes, and we talked about it the last time, Andrew. 100% agree. Let's not talk about efficiencies and cost reductions and what that means for services every single meeting, if possible.
David, you had your hand up before. Did you want to?
No, I think we've probably gone around this long enough.
Yeah.
I think Mike has kind of picked up how the allocations work. I think the one thing probably, Jonathan, whilst it is interesting in terms of how the allocations work, I think probably the confidence is on those financial plans and the gaps that we reported when the budget was set, and the 3.4 million pound gap from an NHS Lothian perspective and the 800,000 pound gap. I think we've got confidence in those figures. It's just the accounting treatment and how the funding is allocated that will need to catch up throughout the year.
Okay, thank you.
And I think as we move into the end of the first quarter and we get some numbers, we'll start to see what the in-year pressures are against that. And we're not quite in the position because of how, particularly how the council's numbers work the way through the system. But we need to be moving as an IJB into those conversations about transformation fairly quickly in the next few months. Mike, anything final to say? I'm not seeing any more hands.
Nothing from me, thank you.
Okay, so there are four recommendations, 3 noting and 1 to approve the funding offer. Are we in agreement? Yeah, I'm seeing plenty of nods and things around that, so I think we will accept that. And thank you, Mike, and well done for responding to Jonathan on some of his interesting technical accountancy questions. Yeah, I won't say any more. Okay, thank you very much, everyone. So we move on to our next substantive item, which is the IJB Equalities outcomes. Kate, are you on the call to introduce this?
I sure am.
Thank you.
Hello, it is that exciting time that comes every 4 years when we need to confirm our equality outcomes that we're going to work on for the next 4 years. So our period is 2025 to 2029. These equality outcomes are part of our responsibility as an IJB to contribute to public sector equality duties. If you do read the whole outcomes document, you will see that those duties are defined under the general duties. It's about eliminating discrimination. It's about fostering good relations and increasing access for people. I have also slightly rolled into the outcomes things around the Fairer Scotland duty, which we are also responsible for, which is about taking due regard to people's socioeconomic situation in our decision making. So that's all rolled in. So what I'm hoping to get from you today is for you to consider the outcomes that I am suggesting and to approve them. They've come out of quite a long process of engagement with the community and with staff and with different people. You have seen them before in an earlier iteration. They have moved on a little bit because I've had some comments from the health and wellbeing groups around the county as well. So what we have in the end is participation and co-production, dignity and respect, anti-racism, enabling independence, and health inequalities. What we're looking to do is support the strategic objectives as well. So really work towards the early intervention prevention, really honing in on that. With the health equalities, we are tied in again with the JSNA and other figures that we can find so that we can try and support becoming a more equal county. Have you any questions you would like to ask?
You went straight into it there. Thank you. So we open it up to comments and questions, and I know that there was some discussions at the last development session around this and related issues. So we open it up for any questions, comments, observations. Lynn.
Thanks for a really good report. I think I would want to start by asking, excuse me, as someone who's a ward councillor, sometimes at area partnerships and community council meetings, we get accused of over consulting with communities. And I suppose I'm curious about how we're going to get the balance on, in terms of that first outcome, participation in co-production, getting it right for the people that need to be accessing the services, and how, you know, what particular steps we're taking in terms of getting that balance right.
Yes. So one of the parts that is referenced within the actual outcomes, the actions that we're planning to take around the outcomes, is developing a new model of community engagement across East Lothian. There's a few different things that are on the boil at the moment to make sure that we don't over-ask people. So one thing is going back over consultations that we've already collected and organising that information in such a way that if someone has a question that they need to ask, we can go back to that database of information we already hold first to find out what we already know, and then make sure that we're asking newer questions when we're asking people fresh. So that's one part of it. Another part of it is getting more lived experience voices into things. I'd like to take a fundamentally different approach there, and to be working with our grassroots third sector partners who are already speaking to people on a regular basis, to actually try and collect opinions from people that we don't normally hear from in environments in which they're comfortable, but it also means that we don't rely on the same people over and over again, as we have somewhat in the past. So I'm hoping for lots of exciting things there. You will hear more about it very, very shortly. Probably at the next IJB, I'll have more to say. But that's roughly how we're planning to avoid people feeling fatigued from it, because I do hear it. And I don't want to be doing the same things over and over.
Okay, great. And my next question is around the anti-racism outcome. Some people, and I'm obviously it's covered in the paper, but some people just access our information by watching this, for instance. So I just wondered if you want to take the opportunity of being clear why that is in there at this point.
Yep, so it's to support the NHS Lothian work that's going on within our health delegated partnerships. So it's partially because of that, and it's partially because we are becoming a more diverse county, and we need to be prepared for what that means in terms of our staff becoming more diverse, but also our community having different cultures, different practices, and what that means for when we're delivering the services that are delegated to us. So we're really hoping to develop something like, I'm not sure what the word will be yet, but I'm calling it a respect charter for now. And it's about helping the community understand how they should be treating people that are offering services to them, but also how the community would like to be treated too, to make sure that we're all on the same page there. So it will take some time to develop, but one of the main areas we're looking at is care at home. And sort of moving on from there.
Okay, thanks for that. And I suppose that, you know, the only comment I would want to make on that is, obviously we live in let's just say interesting political times where you know, certain voices are getting louder and louder, and I think that might be a useful practical approach to try and address some concerns that people from different ethnic backgrounds might have. Thank you very much.
I think that's a really important comment, Lynn. I think we need to take cognizance of this as we go forward in the year ahead. Thank you. Amjad.
Thank you, Chair, and thank you for the report, which is really comprehensive and very easy to read. And my question really stems partly answered. Lynn asked about the anti-racist organisation, and it's a great thing to do. And are you working with NHS Education for Scotland and NHS Lothian, because and others who have experience in becoming anti-racist organisations, and what to do? And also, how will we measure whether we've achieved these things or not? And this is asked in the light of reports recently about racism in schools, for instance, and the increase by 50%, and some schools not knowing really what to do.
despite having training. So training sometimes isn't enough, because if people haven't dealt with issues, it's like a rabbit in a headlight situation. So it's really around how good is the training, and are we learning from organisations who've done this? Thank you.
Yes, so we're very much working with NHS Lothian. They have done quite a lot of work on this. They've produced some very good videos as well to help people to understand what people are experiencing, particularly in the workplace. So I'm definitely working with them. I'm also tying in with our peers across Scotland who have done different work on experiences of racism, particularly from care at home staff. So I think it was Lanarkshire that's done something on this, but there's a few different places that have done some research. We're very much hoping to take away a lot of the research that's already happening, seeing how we can apply it here, and going from there. In terms of training, I don't like to rely too much on traditional training, because I prefer to make sure that people understand what they should do in their particular roles. So I think working towards equipping people to have the uncomfortable conversations that need to be had, helping people to understand that it might feel difficult for them emotionally to discuss some of these things. I'm very keen to focus in that direction. I have got some experience in universities looking at anti-racism as well. We can see if any of the things that worked in those contexts might work for us. But also, so what you do first is you publish the outcomes, and then you produce a plan. So in the plan, we'll have a much more broken down idea of what we'll do. I do have some ideas about how we measure it as well, but it is a little bit of a tough one in that respect, because sometimes you can find as awareness improves, you also get reporting rates improve, which is good, that people are feeling good to speak about it. But sometimes you do an education thing and then it looks like everything got dramatically worse. So it's, we'll make sure we think about some really thoughtful indicators that we can come up with. But happy to hear from anyone if anyone's got ideas.
Thanks, Amjad. Elizabeth?
Thanks. Thanks, Kate, for the report. My question's about in the mainstreaming report, and it's mentioned about the previous lack of significant progress from the IJB's perspective on building an inclusive staff culture, and how you're going to take a different approach going forward. I was just wondering, obviously, it sounds tricky when you've got two different organisations, and I just wonder how aligned you think they are in coming to that issue. And also, it's mentioned that training opportunities is one way to overcome that. And I was wondering, is there a sort of funding implications for that, given that obviously the financial constraints that we're operating within? Thanks.
Okay, yes. So in terms of, I'll go back to the beginning. There's a question about whether the particular outcome around creating inclusive staff communities was something that was within the remit of the IJB altogether. The last outcomes was written from a perspective of HSCP, which wasn't actually quite from the correct perspective in terms of who's got legal responsibility for it. So it was a tricky one to have there, because it sits with partner organisations. And the reason why I've talked about using training is because we can absolutely authorise training for staff that carry out our delegated services. I think we absolutely should. There's quite a lot of training that I can conduct myself, which is obviously the most cost-effective that we can do, or we can skill me in something or skill somebody else in something and then use it that way. I quite like there being an ongoing resource skilled into something rather than hiring in external trainers too often, because A, it's expensive, but B, once they've stepped away, there's no sort of continuity there in actually having someone for people to ask questions as their situation is applied. So that's roughly where I stand on that. Is there more bits to your question? I can't recall now.
I think yeah, that's really interesting what you're saying about using the resource that we already have in yourself, rather than bringing in external sources, which sounds good. Yeah, I suppose the bigger question is the alignment of the two organisations on this one. But I guess that's a very big question. I'm not necessarily expecting you've got the answer to that right now.
It's an especially tricky one because NHS Lothian are working on the same timeline that we are, roughly the same. So their draft outcomes came out slightly before ours, so theirs will be published now. The council is in fact working on a totally different timeline, and they're not planning to have their equality outcomes actually sort of ready until I think September was the last I heard. So there's a little bit of a disconnect. We did all do the consultation together in Pan Lothian, but in terms of actual alignment, we won't really quite know until September. But I will keep in touch with my counterpart at the council to make sure that we can align things as best we can.
Thanks.
Claire, next.
Yeah, thanks. Hi. Again, also enjoyed reading the report, and I'm sure it's very high level, but I just wondered, sitting underneath it, are more specific actions.
Claire, I'm struggling to hear. I don't know if others are. You need to move your mic down, I think.
Yeah, sorry, got my mic was above my head. Yeah, it's a very high level report. It's really excellent, and I'm sure sitting underneath it are much more specific actions in terms of improving institutional response and institutional anti-racism policies, which are quite practical, such as, you know, access to interpreters, access to language specific things, and which spans, I guess, inequality and anti-racism policies. So, and also within the sort of inequality and the poverty aspect, people who are completely missing from documented healthcare, so all the people who don't make appointments, who don't come up to see the hospital, they're very easy to be missed out of all kind of reports, everything. And so I just wondered, is sitting underneath this a sort of practical outcome measures that we'll be able to measure that will actually assist people when they're accessing care? I'm sure it is.
Yes,
Thanks.
there sure is. So there will be a whole plan developed. We basically had a situation where I arrived mid-October to the organisation, and these were all due for publishing April. So we've moved it along as quickly as we can for the timelines that we need to move with. Basically, what normally happens is that organisations approve their outcomes and then they produce a whole implementation plan. So that could be next month, the month after, however we want to look at that, because we'd be co-designing that with the community anyway. So there will be far more broken down ideas about how these different things will look, but certainly in terms of people that are at the moment not very engaged with this, it's something I'm putting a lot of effort into. And one of those ways is by really strengthening my contacts with community organisations across East Lothian that actually are speaking to people who pretty much are in this bracket. I was at the Ridge on Tuesday morning, which was fascinating. Just the people that were coming in constantly, the sheer foot traffic of people that we never see was really promising. And I think it's important to work with organisations that are already working and have built healthy relationships with people that don't always speak to us, to find out how we can actually go to where people already are and where they're comfortable to find out what they're thinking.
That okay, Claire?
Yeah, we've done a lot of work in my service in infectious diseases, which has a huge sort of proportion of the patients in extreme poverty, obviously, as you can imagine, around identification of the patients that we're not seeing and improving access. So I'm really happy to talk to you in more detail around what we've tried to do to make sure we can measure who that group, know who those patients are, and sort of novel ways we design a service around. It's a bit like designing NHS services around where the patients are, a bit like you're talking about with the third sector, and not for what suits the service. And it's not easy, but we've made some progress. So I'd be happy to talk further about it if it's of interest.
Yeah, it sounds brilliant. I'd love to.
Thanks for that. Shameen?
Yeah, no, thank you. It's a bit of a follow on from Claire about tackling where we know where there's the highest levels of inequality. We know the data and the intelligence. We know in some parts of East Lothian, your life expectancy is a difference of 10 years. So it was around it, but how we support staff to be able to do that work. But specifically on page 62 around the poverty plan, we know that's, that as a result of poverty, there's a huge wealth of health inequalities and other barriers around how we support staff in the challenging environments to maybe think or do things differently that we know will then have better outcomes. And I just wonder, is that something that lies underneath this, and that to come back and to be able to say to Claire, actually we've done something differently, or we've tried something different, and as a result we've got better outcomes, and be able to target people in areas where we know there's very high levels of inequality, maybe low uptake and vaccinations or wherever the stats might be, and we've seen a change in there, but be able to provide support to staff to be able to do that work.
Yeah, very much. So what we're hoping to do is, once we know where we'd like to go with our outcomes, we develop all those indicators and then move along with that. So I'm going to be working closely with public health. I'll be working with all sorts of different organisations to try and see where we're performing particularly below Scottish averages. So there's a lot of health inequalities related with poverty where we're actually doing okay overall. But there's a few areas where we're not. And certainly it'll be interesting to see how we can improve those particular figures. And there'll be people that know far better than I do across our organisation exactly where those are. And I will be listening to those people and to people who are actually experiencing it to find out what we think the best indicators will be. Because we don't want to be working towards something that makes sense to us but doesn't mean so much to people on the ground. So we're hoping to make it as practical as possible.
That's grand. And the final one was around the commissioning. How effectively do we capture that a lot of the commissioning services are tackling health inequalities, are addressing barriers by doing things we might not be aware of? So one of the services provides a lift to people to hospital, but what they do is they check with them beforehand, check that they've got the right time and date, etc., and doing all these other things along the way to make sure that they're not a statistic of somebody that hasn't turned up, but it's a person that needs to be at that appointment. And we're just capturing all of that, because I think a lot of the community third sector organisations do a huge amount of that, tackling health inequality and reducing barriers, and I always feel sometimes it's not captured, and that's where we get that difficulty of, funding the voluntary and community sector when we know that it does provide and have better outcomes and support people and tackle health inequalities, and we wonder whether that funding should go to them or not, when we know the evidence and capturing that evidence so people can see it is that they do make a difference locally.
Yeah, it's one of the toughest things, because when you're sometimes when you're looking at things that are prevention or early intervention, you're trying to measure things that then didn't happen. And we've talked about this so many times about it's quite difficult if it's not a reduction in this number, but it's sort of, I don't know, it's quite difficult to work out how to do that. I think we need to talk about it, and I think it would be really good if we can try and work out how to quantify some of those sorts of improvements. I'm also really interested in mapping how community organisations at the grassroots level are feeding into our entire process, so our early intervention and prevention particularly, into the services that we're delegated, so that we actually know if these organisations are getting it right, we should be seeing a lesser flow into some of the other service parts that we look after. I think it would be very helpful to know that, and to really know it very clearly. So I'm working on producing some maps in the next month or two that will help us all to understand how the systems interconnect. If anyone's already doing that, I would absolutely love to know, so I don't redo it. But that's something that I think will be very important.
Okay with that, Shameen? Okay, I'm going to take a final comment from Christine, I think.
Yeah, it was just a quick response to you, Shameen, around the commissioning. So we do now, in our work with the providers that we commission to outcomes. So we're getting outcome reports about what difference did the service make. So we have quite a lot of rich data. It's just not just the numbers. The old-fashioned approach is just to look at the numbers, but we are looking much more about outcomes, and we have all of that data as well.
Okay, thank you.
Very last one, Jonathan.
Sorry. I just want to lend my voice to supporting the. I mean, sorry, a combination of some of the other comments, which are this, Kate. I mean, all this stuff does at some point need to be measurable, data driven, evidence driven, and I know that's difficult, but I think if we're doing this properly, and this isn't just box ticking, we need ways of working out whether what we're doing here actually makes a difference. And I think we have to be super careful with the data side of things. I mean, if we look at the workforce plan coming up later, we see that 30% of NHS Lothian staff we don't even know what their ethnicity is. So we need to be super careful whenever we present data and evidence in this area. You know, and I think and as Lynn said, actually not over politicize some of that as well, because some of the data I think is slightly politically driven, unfortunately. So I think we need to be very careful. But measurement, it's great what we're doing here, and I thought that the development session we had in Haddington was fantastic a month ago. And those who couldn't make it from the IJB, I don't know how they could catch up with some of the discussions we had, which were really helpful, I thought. But yeah, let's just have a data-driven evidence approach here and impact-driven if we can, not just words on a page saying nice things as a sort of management speak. So that would be my ask.
I'm sure Kate agrees, and we'll respond accordingly. So I'm going to draw this bit to a conclusion. Thanks for a excellent set of conversations and discussions around this. I'm sure there's much further work to do. The papers again is high quality, and the development session and these conversations are all adding to our work with that. And I think, Kate, you'll take due cognizance of all of the comments that have been made. We've got some formal recommendations at section 2, which is to read, consider the outcomes and approve the equality outcomes for 25 to 29, and to have considered the content and approve the equalities mainstreaming report for 23 to 25. I am very supportive. I'm assuming colleagues are as well. I'm seeing lots of nods and lots of support. So, Kate, thank you very much indeed. It's all approved. Thank you.
Thank you.
Okay, we move on to the next item, which is the strategic workforce plan, Nikki, and we'll come back to the point Jonathan raised at the beginning, or in this as well in the conversation. So let's not lose sight of that. So, Nikki.
Thank you. So the Scottish Government haven't yet asked for the next workforce plan, as they're aware that health and social care sector is all under a lot of pressure just now. However, the previous workforce plan ended in April, so we have written the new one ready for when they do ask for it. The next workforce plan will run until 2028. In the previous workforce plan, we have had quite a number of successes and achievements, which are all listed in the paper. The majority of the next workforce plan will be able to be delivered within current budgets. However, one section of it to be able to deliver SVQs to East Lothian High School students to be able to encourage a younger workforce into the health and social care sector would require a one-off funding of £50,000 to establish an SVQ centre. But otherwise, all of the information is in the paper for you, and I'll hand back over for any questions.
Indeed, we open it up to any questions. Lynn first.
Yeah, thanks, Nikki, for that. I just wondered if I've not seen any specific, and it might be because I've not read it in enough detail, to be entirely fair. I know that nationally a lot of care providers are concerned about some of the implications for recent changes or proposed changes around immigration. I just wondered if that's something that is a particular impact or concern for us as an IJB. So our internal services tend, particularly on the council side, tend not to recruit from overseas due to the costs of the visas. So it's not a huge implication for us. Okay, thank you.
Okay. Do you want to come back in on that one particular point, Laura, before we move to Jonathan?
Yeah, if that's okay, because I think there is something there. So obviously our care at home providers in particular some of them do have a very high level of overseas staff, and although it doesn't look like that will be impacted on current staff, obviously there's a group. So it is something that I think we certainly are looking at in terms of our contract monitoring and support of the providers, because I think it does add pressure. Well, it will add pressure onto our social care services, particularly in that area. So it is something we will need to be mindful of, and it might be something we bring back to the IJB as highlighting areas of concern for us.
Anything showing up at this moment in time in terms of the from our commission services?
Not that they're reporting difficulty right now, but we are aware of certainly one of our care at home providers that has around 70% of their staff will be overseas staff, and has a significant impact here in the East Lothian. So yeah, we'll just be working with them to see what the impact is and how they're going to manage that. But it is concerning.
Jonathan?
Yeah, thanks. Yeah, I think it's a really interesting plan. I've got a number of questions. I guess just stepping back a bit, I just want to think about this in terms of the strategic plan which we are developing this year to 25-30. And when I sort of think of the workforce plan, which is 25 to 28, I guess my question is, the workforce underpins everything we do, and it supports the priorities of the IJB, but we haven't worked out the priorities of the IJB yet, and here we are talking about priorities for the workforce for the next 3 years. So I'm just kind of thinking about the timing of what we're actually agreeing here. I know the previous one has expired, but I'm not quite sure if I understand the sort of timing of how we're working out what the workforce plan is when we haven't worked out what the priorities are of the IJB. And the second question is, again, we know, as mentioned in the paper, there are the individual plans of NHS Lothian and the council. So again, how does this build into that? And we always have that problem in terms of that interrelationship. So I guess that's my fundamental first question. Maybe I'll stop there for that first one.
Yeah, so the strategic plan is going to be for a 5-year period, but we would never write a workforce plan for a 5-year period. We would always keep it down to 3 years, because things change more often with the workforce. And, although the strategic plan will have its priorities, as that changes, it can build into the workforce plan. The workforce plan will be an ongoing working document that the actions can be updated as they go. We will feed back to the IJB on an annual basis what we've achieved and what new plans or updated plans will be.
I think there has to be a level of pragmatism as well. We are going through significant financial challenges. We've got our own strategic plan. Then there's opportunities for all of these plans to be amended, and sometimes we're recipients of instructions from government that you have to have this plan in by this date, and I'm not sure there is due cognizance made at a governmental level at times as to the interrelationship between these. But I think we have enough practical common sense within the IJB and the HSCP and Council and NHS Lothian to know that no one document ever just sits there and will drive a set of behaviours to the expense of another. That would be my take on it, John. So
no, that's fair enough. I just think they've been non-coterminous, and this way round I don't quite follow. But anyway, that's the way. As long as it's on that basis that this will change. This could change quite radically in 6 months' time or 12 months' time once we've worked out what the strategic plan is for the IJB. So that's fine on that basis. And
another piece of UK legislation that comes in may well have significant implications for both the IJB strategic plan and the workforce plan, and we'd have to adapt accordingly. Okay. Shameen.
That's fine.
And I don't know if Laura wanted to come in on Jonathan's point.
Yeah, and I suppose it was just remembering that the workforce plan, as you said, Jonathan, I suppose it's that we are caught with the NHS and ELC as the employing partners, and Nikki has that job of trying to please both partners while also writing an independent plan. But I think what's also important in the plan is what we're trying to do is have those underlying principles about our workforce. So how do we assure ourselves that we have a sustainable and robust workforce, no matter the service that we are able to deliver, and it's versatile. So it covers the training, the workforce, the well-being of our staff, the apprenticeships, etc. These are the things that I would see being important in our workforce plan, as opposed to the specifics of we need these staff here to deliver this service, because as we've just all said, that seems to change and ebb and flow depending on what idea has come forward. So yeah, I think the important bit for me is, are we getting the principles of our staffing right, and they are strong and a versatile and robust workforce that are well supported to deliver the services however they may look. And that's the important bit for me on this workforce plan.
Okay, I've got other questions, Andrew, but I'll let others.
Shameen, did you have a question as well?
Yeah, no, thank you. It was around the health and well-being, and it was on the back of the lead professionals report, and I was just really conscious of what was coming out of there and how staff were feeling about making decisions and moving forward around that. How much has that changed the health and well-being offer to staff, having seen that report? And the other one was about looking forward. You've mentioned about the working with the high schools as a one-off non-recurring funding. Have you applied anyway for that, or is that in there to say, look, this is what we require, but we don't have anything at the moment, but we are looking, because I think that was something that we'd want to strongly consider, looking at the workforce issues that we've got.
Yeah, so I'll start with the health and wellbeing. So we have got a wellbeing lead who's based in my team. However, that is not her primary role. It's a kind of a tag on to her current role. So we don't have funding to have a wellbeing lead in East Lothian, unfortunately. But we are doing as much as we can with the little resource that we do have to sort of implement health and wellbeing across the partnership. And what we're going to do just in the next few months is create a group of health and wellbeing champions for each team, so that we've got that knowledge of what's happening in every single team and what good work we can share across the teams. For the apprenticeships, we have looked at how we can possibly fund it. It's a bit of a catch-22 situation. So we only need the funding for the first year, because once we have the team set up, we'd be able to claim funding from Skills Development Scotland to keep that running. So yeah, we've had the discussions with East Lothian Works, and they've obviously said to us that we can get funding from Skills Development Scotland, but we can't do that until we've got somebody in place to kick it off. So is that, you know, we need to have the funding there to have somebody in place to create the packages to be able to deliver it, and then once we've started delivering it, then we can start claiming the funding back. So it is just that initial £50,000 that we're struggling to find.
Okay, so there's not any funding for that as yet. So you're still looking for that. Okay.
Yeah.
Sarah, next.
Thank you, Andrew. So I suppose just a couple of comments. So just coming back in initially on the health and wellbeing, absolutely, Nikki's team are doing a huge amount. I think what's really encouraging is that individual teams and team leads see it as their priority as well. So we get to hear about quite a lot of actions and activities they're doing around health and wellbeing. So I do feel it's a culture that is seen as a priority across the teams, which is really encouraging. And then just coming back on Jonathan's ask around how the workforce plans all sit together. So I suppose if I speak from a health perspective, I never see them in isolation. I see them very much as working together and as linking together. So for example, from a nursing and a professional aspect, I very much link into what NHS Lothian is doing from my teams and link in and look at how the two strategies work together. So for me, they don't work in isolation.
Thanks, Sarah. Jonathan?
Yeah, sorry, if it's okay, Andrew, I'll come back in then. I don't see any hands raised. I've got a few other questions. I mean, firstly, it'd be good to go back to that original question I had about any impact we potentially foresee in relation to overseas work visas that the UK government might impose later in the year. Secondly, I think just on page 100, where we show some data and it's described as nationality, but I think it actually is ethnicity. So we need to be quite careful how we use language. I think it's not nationality. It's the table on Scottish, white, Asian, African, Caribbean. I believe that means ethnicity. And I guess my question is also been, how can we actually had the same question this time last year when we were doing some anti-racism work for NHS Lothian, and the gaps we had in the data, as we show in this table, that nearly 30% of staff haven't actually declared their ethnicity. Is there a way somehow where we can close that gap and therefore get better data and make better decisions? Because I'm not sure of the conclusion in this report where we actually state that we have more, the previous page says that we have a more diverse workforce than Scotland. When I add up the numbers of white versus non-white, actually we are not more diverse. I'm sorry. I think it's we're very careful how we interpret the data. Again, just a small point maybe. And then finally, sorry, my final point was just on later in the report, and I think it's really good that we have had an uptake in appraisals, and it says that staff of 62% of staff now do annual appraisals, up from 39% last year. I think that's really good. My own ask, if possible, and I've raised this at NHS Lothian, is these really should be mandatory in my mind. I think if we're looking at trying to drive a better performance, a high performance culture, I don't think appraisals should in any way be voluntary. But that's just a personal view, and others may disagree. So there's my three comments, Andrew, if that makes sense.
Kate, your hand came up very quickly. You want to come in and respond before we hand back to Nikki? And you're on mute as well.
Oh, what a pickle. So in terms of people not disclosing their race or ethnicity, that is it's a very common problem, and everybody's been trying to work out what to do with it. The only progress I've seen with this is explaining what you're going to do with it when you're asking for it. And sometimes that will help people to feel more comfortable. Some people actually don't think it's relevant at all, and they will not tell you, no matter what. So you do sort of have to accept that there will be a group of people who will feel like that for their own reasons. The level that we have, 30% not disclosing, is actually very standard, just so that you know how it compares across almost everything. It's often about 30%. So when I worked in colleges and unis, it was about the same. Council's about the same. Normally that's roughly what you get. So we're not performing any less well than anybody else, but it would be nice to perform better.
I just think we need to be very I mean, yes, 100. I think that's all very sensible. Okay, I just think we need to be very careful when we interpret the data, because of that, the gaps in the data, but also how we, recognizing that when people have been asked these questions, I mean, the differences between white Scottish, white British, white Irish, white other, and then we use data based on those differences. Be very careful how we interpret that data, because I'm not sure that the questions have been asked in a certain way to deliver accurate data in the first place. So I think we just need to be super careful and super sensitive in this area. So that was, yes.
Thanks both for the intervention. Nikki, any things to come back on as well there?
So just on your PRDs and appraisals, as much as I would like to make them mandatory, unfortunately, that's not within my gift. And so on the council side, we've not actually reported on the council side because they don't have a mechanism for recording what appraisals have been done and what haven't been done. So we're trying to do something separately, just by means of spreadsheets, and we'll hopefully be able to report on that soon, what the actual completion rate is on the council side as well. But yeah, during the induction process that we've created, we do encourage people to ask for appraisals rather than waiting for their managers to tell them when their appraisals are due. So we are actively encouraging people to use the appraisal process, but other than that, there's very little we can do to make it happen, unfortunately.
No, I understand that, Nikki. And then, sorry, the final question, Andrew, just on the overseas visas, which I think we'll get to eventually.
My intervention on that one is that I volunteer with Citizens Advice, and on my Monday session I did a full day, and every single question was immigration related by someone who had a visa, and the uncertainties and the anxieties that the visa regulations, and I think there's going to be a significant challenge to all sectors, because it's a significant of concern to many people with visas at the moment.
I don't mean
that's a snapshot of one, but it's more of a, any thoughts from colleagues?
I don't mean to crystal ball what will happen. I guess my question is, what is our exposure in terms of our employee base, roughly?
My understanding is that the employee base is relatively low. Our commission services would be relatively high. So, okay. And I think that's kind of my understanding of what Laura and Nikki said at the beginning, and it's something that will be monitored as part of the commissioning framework. I'm sure Laura said at this point in time it's not an issue, because actually the legislation hasn't necessarily gone through, but I think we need to be very, very, very cognizant and aware of it. I think it's causing lots of concern to many people with visas at the moment as well.
Sorry, do you mind if I ask one more question then on this report?
I do, yes. No, of course.
Which I think is excellent, by the way. I think this plan is really
and then Amjad will come to you.
But sorry, Amjad, I'm going to ask, because a really interesting part of this, which I know which has been raised before, is the aging profile, and just how do we sort of address that, and it's talked about in the report, in the plan, in terms of trying to get a younger profile. And this really looks like it's described in the report as a real sort of ticking time bomb for us, in terms of the age profile. I think it's worse in the council than it is on the health side. So it'd just be interesting to hear from officers how we practically we can address this, slowly of course, but how practically we can address it.
So we have been doing a lot of work with the schools, and we have found out that all of our neighbouring local authorities have the foundation apprenticeships within the schools to be able to deliver the SVQ that we've been talking about, and it's just because of East Lothian's location and the fact that there are no providers based directly within East Lothian that we're unable to deliver that, which is why we want to try and bring it in-house, so that young people don't understand what a health and social care partnership is. So we've been going into the schools to try and educate them on it, and to be able to deliver an SVQ within the schools as a foundation apprenticeship would help that as well. So if we can find that £50,000, that will go some way to be able to help us encourage younger people in East Lothian into the health and social care sector.
Thanks, Nikki. Amjad.
Oh, sure, Jonathan hasn't got anything else to ask. Only joking. Very, very quickly, I think the first point is on the ethnicity data, and although we all want accurate data, I think for ethnic minorities it is a difficult question, because often people feel that they should be treated the same as anyone else, and knowing where I'm from shouldn't make a difference, and often is viewed suspiciously as to why do you want to know where I come from. And we had this problem when I was at NES as well, asking doctors in training about their ethnicity. So as somebody already said, we have to deal with it sensitively, but it's a common problem across the UK and not just for Scotland. And just my take quickly on the appraisals. Often I think people view these performance-related appraisals suspiciously as well. I think we have to sell them in a positive way, rather than people thinking, oh gosh, it's my appraisal, what have I done wrong? What things are they going to bring up? And I think that's the viewpoint. And so I think we have to be careful. And the other thing about the visas that you brought up, I think it highlights the importance of making sure that the careers in care and in health are promoted with appropriate pay conditions and given importance that they deserve. And I think that's where we're falling down, and we can't continuously rely on people coming from overseas, skilled people, where poor countries have spent money training these people up, and then we just bring them over here to serve our own purposes. So I think there is an argument for making sure that we're producing enough of our own. Thank you.
Thanks for that, Amjad. That's very much appreciated. I'm seeing no more hands, so I think we'll go to the two recommendations, which is to note the plan and to agree the plan for 25 to 28, with all of the caveats that we said are around strategic plans, etc. So are colleagues content and okay to do that? Again, plenty of hands and nods and thumbs up. So Nikki, thank you very much indeed. Again, another high quality paper. So thank you for that.
Thank you.
So we're on to the section now 10, which is approved minutes from subcommittees. We have the minutes of the Audit and Risk Committee there, and there's a note that Sarah made, just give a very brief update around the Clinical and Care Governance Committee. So Lynn, is there anything you wanted to say around the Audit and Risk Committee?
Thanks, Andrew. I just kind of wanted to just give a highlight on a couple of things. So over the 2 minutes that you've got access to, key things are continued oversight over the audit of the annual accounts and the challenges that that's presented with Audit Scotland, but achieving that sort of alignment between IJB and ELC audits. Obviously, we had a slight hiccup with the process for the annual accounts, but they were approved after the meeting following delegated authority being attained from the IJB via email. Key points in annual audit are really around the financial sustainability and need for strategic directions to be set for delivery for sustainable services, and highlighting the ongoing rigorous work across the partnership and across our governance groups to shape our future plans. In terms of internal audit, focus has really been on directions and the need for audit trail improvements around evidencing the impact of directions. And in terms of risk, significant change in risk has been associated with the appointment of new CFO Mike, and I'm delighted to say that we're developing a really productive working relationship in that regard. Another slight change in terms of the emphasis and risk in the National Care Service, although obviously that can come up and down.
Right. Thank you very much, Lynn. If there's any questions, then please, but they're there for information. Okay. I'm seeing no hands, but thank you very much for that update, Lynn. Appreciate that. Sarah, so some thoughts on the committee.
Yeah, thank you, Andrew. So our clinical care governance met back in April. We're still, for those members that are not aware, we're still reviewing our processes. So when I came into post, was asked to have a look at actually what our governance processes are within this committee. A report had been done previously into that. So we are just reviewing what that structure, I think we're almost there with that structure. We're just reviewing our documentation at the moment. And I think what's very encouraging is that all of our local teams now very much have a focus on governance, or more of a focus on governance, and have their local committees as well. So obviously the purpose for our committee is providing that, giving that assurance around ensuring that the care that we're providing is person-centred, safe and effective. So we discuss all aspects of care around that. We identify any new risks. We review any existing risks as well from a professional perspective. We review our SAEs, our DATEXs and our complaints, and we also ensure that we're closing the loop with the learning around that as well. So our annual report will be presented to NHS Lothian. I think our date is September. And from that, Andrew, I'm wondering if what we tend to do at that is present some maybe key projects that are happening, and I'm wondering whether that would be appropriate to bring some summaries around those after we've given that report to this meeting. So I'd welcome some thoughts on that.
Okay, as I look forward, as Chair of Healthcare Governance, I look forward to receiving that paper and all the IJB papers at the appropriate point in time. The key there is what information is fed back to the IJB, and I think I think we would welcome an appropriate feedback and report as you see fit, Sarah, to give the level of assurance to the IJB around those matters. But I'll open that up briefly if there's any comments that people want to make on that. I'm not seeing any hands, so Sarah, speak to Fiona and I, and we can have a chat beforehand as to what will be appropriate to bring to the IJB. Okay. Thank you for that. I think having the minutes and that narrative has helped in our work on the IJB. We've got one final piece now, which is if there are any members of the public or press on the call, please could I ask them to leave, and Neil, could you turn the recording off, please, as well?